My name is Crystal Rocket. I'm an NU361 TE7. Today I will be performing a physical assessment on Mr. Eric Hunt. He has already given me permission to record him. Good morning, Mr. Hunt. My name is Crystal Rocket. I will be your nurse for today. Today I will be performing a physical assessment on you. Is that okay?
Yes.
This assessment will be confidential. First, I'm going to start off by providing you with some privacy. Wash my hands. How's your day been going?
Good, and yours?
It's going good. Thanks for asking. Are you in any pain?
No.
Good. First, I'm going to start off by inspecting the skin on your face and inspecting your face for expression and symmetry. No redness, no edema, no dry, flaky skin. I see that your face is symmetrical and round. I'm going to inspect your scalp and your cranium. Hair, no thinning, no shedding. Any pain?
No.
No masses, no nodules, no depression. I'm going to inspect your temporal arteries. Both arteries palpate normal, bilateral, symmetrical. Now I'm going to palpate your temporal mandibular arteries. Open and close your mouth for me. No clicking or popping sound. Any pain?
No.
Very good. Now I'm going to evaluate cranial nerve 5. If you could, please clench your teeth for me. And try to open your mouth against resistance. Very good. Now I'm going to focus on sensory motion. Close your eyes for me. Say now when you feel this.
Now. 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 Now.
Okay. Close your eyes again and say now when you feel this.
Now. 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 Now.
Now I'm going to inspect your face motor function, cranial nerve 7. If you could, please lift your eyebrows. Close your eyes tightly. Smile. Frown. Show your teeth. Puff your cheeks. Very good. Now I'm going to inspect and evaluate your eyes. We're going to start off with inspecting for cranial nerve 2, the visual acuity test, using this Snellen chart. If you could, please stand up for me. And I want you to stand 10 feet away from the chart. Do you wear any corrective lenses or glasses?
No.
Very good. If you could, please cover your right eye for me and read the lowest line you can read.
E. Z. O. E. C. F. L. D. P. B. T.
Very good. Now, we're going to do the same thing with your left eye. If you could, please cover your left eye and read the lowest line you can read.
Z. O. E. C. F. L. D. P. B. T.
Very good. You can have a seat. Now, we're still focusing on the eye. I'm going to assess your cranial nerve 3, 4, and 6 with extraocular movements. If you could, please look straight ahead for me. Do not move your head. And I want you to focus your eyes on the pen. Very good. No involuntary movements. Now, we're going to still focus on cranial nerve 3 with accommodation. If you could, please look straight ahead for me. Do not move your head. And I want you to look only at the pen with your eyes. Do not move your head. Both eyes constrict and cross bilaterally. Very good. Now I'm going to test your eyes for convergence. Please tell me when you see blurred vision.
Now. Now.
Very good. Now I'm going to inspect your eyes, your pupils. Right eye. Right eye constricts. Left eye constricts. Both bilateral pupils are equal, round, and reactive to light. Now I'm going to inspect your external eye. Please close your eyes for me. Bilateral eyebrows, eyelids, and eyelashes. No crusting, no drainage, no dry flaky skin. You could open your eyes for me. Now I'm going to inspect your internal eye. Open your eyes for me. Bilateral sclera is white. Iris bilaterally is brown. Bilateral cornea is clear, no opiocytes. Look up for me. Bilateral conjunctiva is pink and moist. Now this part of the exam, we're going to focus on your ears. Going to inspect and evaluate your external ear. Okay? You ready?
Yes.
Very good. Any pain?
No.
Very good. They both are symmetrical. No cysts, no drainage, no redness. Now I'm going to perform the whisper test. I'm going to cover up your left ear. Please tell me what you hear.
Football.
Now I'm going to cover up your right ear. Please tell me what you hear.
Basketball.
Very good. Now we're going to focus on inspecting and evaluating your external nose. If you could, and I see that it's symmetrical and midline, if you could please cover your right nair and sniff for me. Now cover your left nair and sniff for me. Very good. Now I'm going to inspect your sinuses, starting with your bilateral maxillary sinuses. Palpating. Any pain or pressure?
No.
Okay, I'm going to palpate your frontal sinuses. Any pain or pressure?
No.
Very good. Okay, Mr. Khan, I'm going to inspect your mouth and throat. If you could, please open wide for me. Inspecting your buccal mucosa, your palate. Lift your tongue up for me. Very good. Your teeth, your gums. Good dental hygiene. Or mucosa is pink intact. No lesions, no ulcerations. Now I'm going to evaluate for cranial nerve 9 and 10 by checking the mobility of the uvula and checking the throat and tonsils and the gag reflex. Open your mouth wide for me. Stick out your tongue. Say ah. Very good. Uvula rises midline. Throat and tonsils are moist, pink, and intact. Now I'm going to evaluate for cranial nerve 12. If you could, please stick your tongue out for me. Now, turn your tongue from side to side. Very good. Now I'm going to take off my gloves, wash my hands. Now I'm going to inspect your neck and palpate your lymph nodes. We're going to start with preocular, postocular, occipital, submental, submandibular, tonsillar, superficial cervicular, posterior cervicular, deep cervical chain, and supraclavicular. No hard nodules. Any pain in those areas?
No.
Very good. Now I'm going to evaluate for cranial nerve 11 by testing your range of motion. If you could, please put your chin to your chest. Tilt your head from side to side. Very good. Now if you could extend your head backwards. Very good. Now touch each ear. Touch each shoulder with your ear. Very good. Symmetrical. Range of motion is good. Now I'm going to inspect and palpate your trachea and your thyroid. First, I'm going to inspect and palpate your trachea. Okay. Trachea is symmetrical and midline. Now I'm going to inspect and palpate your thyroid. If you could please hold this bottle of water. And when I tell you to take a sip, please take a sip. You can do this the posterior or anterior way. I'm going to do it the posterior way. If you could please Tilt your head to the right. Now take a sip of water for me. Moving the trachea to the left. Okay, thyroid is smooth and palpable. Okay, now if you could tilt your head to the left. Take a swallow of water for me. Moving the trachea to the right. Thyroid is smooth and palpable. Thank you. Now I'm going to inspect and palpate your carotid arteries. Inspect. Now palpate one at a time. Okay. Now I'm going to auscultate your carotid arteries for any carotid bruits. Using the bell side of my stethoscope. No bruits heard. Okay, now if you could please stand up for me and turn your chair around. Okay, very good. Take your t-shirt off, please. Okay, now I'm going to inspect and palpate the posterior chest wall. Any pain?
No.
Okay. No nodules, no lesions, no masses, no redness, no edema. Okay. Now I'm going to palpate for tactile firmitis, symmetric, and expansion. Now, when I press on each area and say the words 99, I want you to repeat after me. 99,
99,
99,
99,
99,
99,
99.
99.
Very good. Now I'm going to percuss over your posterior lung sounds using my reflex hammer. Very good. Now I'm going to auscultate your posterior lung sounds. First I'm going to percuss your costal vertebral, your costal vertebral angle for flank tenderness on each side before I auscultate. Any pain?
No pain.
Very good. Now I'm going to auscultate your posterior lung sound. Take a deep breath. Another deep breath in and out. Deep breath again. Deep breath again. 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 Last time. Very good. Mr. Khan, now I'm going to inspect and evaluate your upper extremities. If you could please turn around for me. Turn your chair around. Okay, I'm going to inspect and palpate your arms. Bilateral arms are noted symmetrical. Hair evenly distributed on bilateral arms. I'm going to inspect and palpate your bilateral arteries. Bilateral artery pulses are symmetrical. Bilateral radial pulses are symmetrical. Bilateral ulnar pulses are symmetrical. Okay, now I'm going to check for capillary refill. Capillary refill less than 2 seconds in all fingers. Okay, now I'm going to test for range of motion of your shoulders. If you could please flex forward your arms above your head. Hyperextend your arms behind your back. Very good. Now if you could please abduct and adduct your arms. Down to the side. Very good. Now I'm going to test for range of motion of your Elbows, if you could please flex and extend your elbows. Okay, now to resistance. Very good. Now I'm going to test for pronate and supinate with your forearms. If you could please hold the forearms out. Very good. Now I'm going to test for range of motion of your wrists, your hands, and your fingers. Please hyperextend, flex, and extend your wrists for me. Very good. Now close your fist, make a fist. Open your hands and your fingers. Very good. Now touch each finger with your thumb. Very good. Okay, now I'm going to inspect your anterior chest. Could please get up and get on the table for me. Very good. Now lift your shirt up. Okay. I'm going to start by inspecting the skin of your chest. Hair is evenly distributed. No redness, no edema. Now I'm going to palpate your skin. No masses, any pain or tenderness?
No.
Very good. Now I'm going to inspect and palpate your pericardium of your PMI. Area noted light and thumping. No heaves, no thrills, no lifts. Now I'm going to auscultate your heart sounds. Aortic, pulmonic, tricuspid, mitral, normal S1 and S2 heart sounds noted. Now I'm going to assess and auscultate your heart sounds for any murmurs or abnormal heart sounds. Aortic, pulmonic, tricuspid, mitral. Very good. No murmurs or abnormal heart sounds noted. Now I'm going to inspect your abdomen. Skin of abdomen noted with hair evenly distributed, no stretch marks, no striae, no edema. Umbilicus is noted midline. No hernia, no bulging areas noted. Now I'm going to auscultate your bowel sounds. Bowel sounds noted present and active in all four quadrants. Now I'm going to auscultate your aorta and bilateral renal arteries. Checking for any bruise. No bruise noted. Now I'm going to percuss all four quadrants of your abdomen. Tympany noted in all four quadrants with dullness over organs. Now I'm going to lightly palpate your abdomen. Any pain or tenderness?
No.
Very good. No masses or nodules noted. Now I'm going to deeply palpate your abdomen in all four quadrants. Any pain or tenderness?
No.
Very good. No masses or nodules noted. No enlarged organs. Very good. Okay, now I'm going to palpate your liver. Please take a deep breath for me. Okay, area noted soft and smooth. Now I'm going to inspect and evaluate your lower extremities. You're going to take your socks off. Okay. Inspecting bilateral lower extremities. Hair noted evenly distributed. No redness. No edema noted. No pretibial edema noted. Now I'm going to test your pulses. Bilateral popliteal pulses noted symmetrical. Bilateral posterior tibial pulses noted symmetrical. Bilateral dorsalis pedis pulses noted symmetrical. Now I'm going to test for capillary refill in your toes. Capillary refill noted less than 2 seconds in all toes. Okay, now I'm going to test your range of motion bilaterally in your hip, leg, and knee. If you could, please raise your leg at a 90-degree angle. Very good. Now the other leg. Very good. Now bend your knee to your chest. And the other leg. Very good. Now abduct and adduct your legs for me, please. Very good. Now extend and flex your knees by turning them in and out. Very good. Now invert and exvert your feet for me. Plantar flex and dorsiflex your feet for me. Forward. Plantar flex. Dorsiflex back. Very good. Now I'm going to assess the strength of your plantar flex and dorsiflex against resistance. Okay. Plantar flex up with your feet against resistance. Very good. Okay, now dorsiflex, push against resistance against my hand with your feet. Very good. Okay, now I'm going to check your Babinski reflexes. Toes go down. Very good. Both toes go down on each foot like they're supposed to. Now if you could please sit up for me and turn around. I'm going to rate your patella and your Achilles heel. Very good. Reflexes are symmetrical on both patella. Now your Achilles heel. Where your Achilles. Very good. Reflexes noted bilaterally symmetrical on Achilles. Now, if you could please, I'm going to test your cerebellar function by having you run your right heel against the shin of your left leg. And do the same for your left leg. Very good. Now, I'm going to continue assessing your lower extremities with you standing. If you could, please get up for me. Very good. Now, I want you to walk on your heels that way for me. Now, turn around and walk back on your toes. Very good. Now, I'm going to perform the Romberg test. If you could, please close your eyes and stand still for 30 seconds. Very good. No swaying or loss of balance noted. Now I'm going to assess your muscle strength and cerebellar function. If you could please hop on one foot. Now do the same thing with the other leg. Very good. Now I'm going to inspect and palpate your spine. Good. Come up for me. Bend over. Okay. Very good. Spine noted symmetrical. No nodules. No masses. Okay. Now, if you could, please, I'm going to evaluate your spinal range of motion. Please bend forward and touch your toes. Now, stand up for me. Now, bend backwards. Bend sideways to the right. And bend sideways to the left. Now, I would like for you to please just twist your shoulders for me, back and forth. Very good, Mr. Khan. That completes our physical assessment.